Good, Mike?
Yep.
Okay. Good afternoon, everyone. It's good to see you. Cabinet just completed its weekly meeting, and we reviewed a range of issues as we do each week, but we were focusing mostly this week on ensuring that the progress that we've made in British Columbia, based on the hard work of British Columbians to flatten the curve, can continue. Dr. Henry made a presentation with public health officials and Minister Dix about the state of play with respect to our acute care system, with respect to the number of hospitalizations, and where we're going when it comes to taking on the challenge of COVID-19. We also took a look at a whole range of other issues, which we have been doing since the beginning. We've adopted a cross-government approach to addressing COVID-19, leading every day with a focus on people having a good understanding of the health situation. Dr. Henry and Minister Dix have done an exemplary job of that, and they'll continue to do so. But cross-government, we have a bigger responsibility to provide confidence to British Columbians that the economy will be coming back to something resembling normal in the very near term. Many other provinces have announced plans, and we will be certainly doing that as well next week, and I'll do some foreshadowing of that today. But the first order of business in Cabinet today was reestablishing the state of emergency for another 2 weeks. I know that everyone's looking forward to resuming normal activities, spending more time with loved ones who have been separated over the past number of weeks, and we want to see that as well. But it's going to take resolute action by all of us to ensure that we continue to make progress rather than give up the progress that has been so hard fought for over the past month and a half. So what will the new normal look like? It'll be guided, of course, by the science and the work of public health officials. And it will be a phased-in approach, as other provinces are doing. But it'll be different in British Columbia because, unlike other provinces, we resisted the call for a full lockdown of our economy and instead adopted a different approach. The approach in British Columbia was to focus on how could we keep sectors operating safely rather than shutting them down until such time as we could open them up again. Good example just this week was the tree planting season is upon us. We're going to have silviculture activity across British Columbia, critically important to our forest sector, critically important to our forests that we start replanting in this critical time in the year. So we put in place plans to have a safe operation of the tree planting season. In agriculture, we put in place safe operating procedures for those temporary foreign workers that are coming to help get our farming sector going, and also other practices to make sure that our food supply is safe. We've had a number of incidents where food processing plants have been hit by COVID-19. Now, I appreciate that the vast majority, in fact, all of those plants are federally regulated. The federal inspection agencies that take care of the safety of our food supply when it comes to meat has been the center point of that activity. We've been working cooperatively with the federal government to protect that food supply, and I want to encourage all British Columbians and assure them that we are doing what we can to make sure that there's cooperation with everyone concerned to protect our food supply. But it's not just farming, it's not just silviculture and tree planting. In the construction sector, this week Quebec announced that they were going to reopen their construction sector in the middle of May. We never shut down our construction sector, and that was a calculated choice that we made based on the work of WorkSafe and the Public Health Office to put in place guidelines for the safe operation of construction sites. So although we haven't had 100% participation within the construction sector, many activities have continued as before in a safe manner. We expect that to continue as well. So as we open up sectors, we're also asking people to come up with their ideas of how they can best operate. And I want to, again, as I did last week, give credit to the restaurant sector who are putting in place plans so they can operate safely. It's not just going to be the flick of a switch, as I said last week, and I'm saying again today. The consuming public has to be comfortable and confident when they go into a restaurant that they are going to be safe. Similarly, workers in that sector need that confidence as well. And the only way we build that confidence is to have a set of common protocols, common guidelines in place to protect workers, in place to protect consumers. We've seen this in the grocery sector and other retail operations where Procedures and protocols and guidelines have been put in place to protect workers, of course, but also to protect the consuming public. That will not change as we outline our plans next week. In fact, that will be the foundation of the plan. How can you operate safely? How can we ensure that there are processes and guidelines in place so the public has confidence that they can once again get back to a regular schedule of consumption, whether that's to be buying goods and services, whether it's to spend more time on the leisure activities that are so important to all of us. In order for that to happen, we need to have a plan, and we need to have full buy-in from all British Columbians. So rather than go headlong into a let's start up again tomorrow, we're focusing instead on a slow, methodical, phased-in approach. Yesterday, Minister Fleming talked about the education sector and how we're going to keep our K-12 system operating in the interests of kids, in the interests of teachers, as well as the parents and families that depend on that system so that they can go to work. As more people go to work, the need to ensure that children are safe is going to increase. That means childcare will become more focused. That means K-12 will become more focused, but it will be done in a different way. We don't anticipate a regular return to education as we know it until into September. But we do expect a gradual increase in the number of students in classrooms, and we're working with all of the stakeholders, whether they be support staff, teachers, administrators, trustees, to make that happen. Always focusing on what's in the best interest of British Columbians, as you would expect us to do and as we are committed to doing. There's a whole host of other issues. I know there'll be many questions, but I wanted to just say finally that British Columbians have made great progress. We are the envy of the country. I'm involved in conference calls with other premiers and the Prime Minister on a regular basis. And every single call focuses on how well we are doing here in British Columbia. And they say, well done, John. And I say, no, it's not about me. It's about the people of BC who put the interests of all of us ahead of their personal interests. By staying home, by not coming to work when you're sick. No more of this heroic, I've got a bit of a sniffle, but I'll make it through. That cannot be the way we proceed in the future. Critical to our success will be everybody understanding that if you are not well, you should not go to the workplace. And we need to make sure as a society we're putting in place protections for those workers so they don't feel an economic imperative to go into the workplace. Instead, they feel that they're doing their part to get us out of the COVID-19 pandemic by staying home, by making sure they check their symptoms and they consult healthcare professionals in the interest of not just themselves, but their workplace and their broader community. Those are the tasks ahead of us. They're daunting, but we've made great progress to this point in time, and I have every confidence that we'll be continuing to have that success as we reopen our economy starting next week. Happy to take any questions you may have. I think Jen's on that.
A reminder to reporters on the line, please press *1 to get into the queue and unmute your microphones. You won't be audible till I call your name. Our first question is from Tanya Fletcher.
Hi, Premier. Central One's latest economic forecast says BC's GDP is set to plummet by 7.3% in 2020, and that BC tourism will remain in, quote, a deep funk into 2021. So given that, and also last week seeing, the price of oil fall to extraordinary lows, given all that, how much can your economic recovery task force, how much of the economy can it actually recover given those outside forces?
Well, certainly the indicators are dark for the foreseeable future, but those same projections for a constriction of the economy in 2020 show a robust rebound in 2021, a some 6% growth rate projected for British Columbia from most of the private sector forecasters. So I'm looking to the horizon, hopefully, that we can endure this difficult time, and that's why we're joining with the federal government, putting in place programs to help people get through this difficult period with significant stimulus, whether it be the federal CERB program, whether it be the emergency worker program that is eligible, people will be eligible for effective Friday of this week. Helping people with their rent, whether they're a commercial operation or they're individuals. These are things that will help us get through this shrinking of the economy. But we will also need to ensure that we're focused on how do we welcome the world to British Columbia again when it comes to tourism, and how do we ensure that people will want to buy our products again. If it were just British Columbia, that was seeing this constraints in the economy and the reduction in growth, that would be one thing. But it is everywhere in the world that's seeing these same negative numbers. So although we have quality wood products and a whole host of other things that the world have been buying from us for a long, long time, the world has stopped buying. British Columbians have stopped buying, and so therefore we're going to see a reduction in economic growth. But we do continue to have a dynamic, diverse workforce, multilingual, multicultural. We have a tech sector that is extraordinary. We have a film and television industry that can, I believe, come back more quickly than in other places because of the good work of British Columbians in keeping our curve on growing number of confirmed cases to a minimum. These are the types of things that investors look at when they're looking at now freeing up their dollars when we look at recovery and stimulus into the late summer and early fall. And that's where we're focusing our efforts. Keep in mind, Carol James put aside $1.5 billion for stimulus that we are not touching until we get into a place where people start to have more confidence, not just here in BC, but around the world, that the economy is on the rebound. And so we're watching those indicators closely, Tanya, and they're concerning, but they're concerning in every corner of the world, and therefore we can take some comfort from that.
Our next question is from Binder Sajan.
Hi, Premier. As you know, in BC, non-essential businesses can open if they abide by the guidelines set out by the provincial health officer. So I'm wondering if there's a shop that's thinking, hey, I can abide by those guidelines. Maybe it makes sense for me to reopen. Do they do that now, or do they wait for a signal from your government? And as you said, consumer confidence is a part of this. So even though you could technically go and get your eyes checked or your teeth cleaned, should people again be waiting for some sort of a signal? And how will you build that consumer confidence within the economy here in BC?
Well, there are many sectors that closed down without any initiation from the public health office. I think of golf courses, for example. Dr. Henry at no time said that golf courses should close, but many did. And that was a decision that those companies and those operations made. Similarly, there are other operations that continue to go when they probably shouldn't have. It's absolutely critical that we get our dental services back up and running as quickly as possible, but that is a high-risk area, and Dr. Henry and her staff are working with the Dental Association on how best to get back into regular operation in that area. And we've asked, as I say, WorkSafe to work with public health officers to make sure that sector by sector we can have guidelines that companies and others can understand fully so that they can start to reopen in the days ahead. Why I've resisted as other provinces have done, laying out programs late in April for some time in the distant future is when people see government starting to loosen the restrictions, they assume that that's game on. That's the green light to proceed to regular activity. That is not the case. We still have work to do in British Columbia. Dr. Henry will be tabling the results of her modeling next week. We'll take that to Cabinet, and that will form the final determinations on how our restart will begin. So I am not announcing today that the economy is going to go back to 60, 70, 80% of normal. I'm announcing today that we're very close to that, and we have also got the advantage that we did not shut down every sector as some provinces did. I think people need to take the message away today that we have work to do. Physical distancing is going to be here for a long time, and we need to get our head around that. We need to continue to wash our hands as regularly as possible, and if you're sick, you should not leave your home. You should certainly not go to a workplace. These are principles that we are going to have to embrace for the foreseeable future, not just until there's a formal plan to restart the economy.
Our next question is from Vaughn Palmer.
Good day, Premier. There's a report out of the University of Ottawa that says that Canadian provinces are in danger of having their finances overwhelmed by the strains on the healthcare system. And I know that in the past you said that the federal government should top up its share of funding for healthcare before trying to launch a new program for pharmacare. Have you revived the argument for Ottawa picking up more funding on healthcare with the Prime Minister, and have you gotten anywhere?
I have regularly for the past. Well, in fact, it was on the agenda for our the conference that we never had back in the middle of March when the First Minister's Conference was canceled, the face-to-face conference, and we went to these regular telephone operations. I have to give credit to Brian Pallister, the Premier of Manitoba, who has been relentless on this issue, as has Adrian Dix, I have to say. So I get it in my own cabinet, and then I get it when I'm on the calls with the other premiers. And Pallister and I have been kind of a tag team on this question at every meeting we've had since probably into going back to 2018, prior to the last, 2019 certainly, prior to the last federal election, making the case that although it would be delightful to have more social programs initiated by the federal government, let's focus on that primary fundamental social program that separates us from the United States, and that's universal, accessible, quality public health care. And we are underfunding it at the federal level, have been for some time. This is not a criticism of the current government. It goes back a number of years. It's time to fix that, and I've been making that case at every meeting, and I'll continue to do that until we see some change. I have to say I talked to the Prime Minister privately this week. We didn't discuss that. We had a range of other issues, but he knows full well my view on this, as does the Minister of Finance. Carol James raises it at the federal table as well. And I believe that the government understands that although they have a lot on their plate, and I give full credit to Chrystia Freeland, the Prime Minister, and their entire team for trying to find places to fill gaps as we struggle through this as a nation, and the disparities across the country are well known. Not even before COVID-19, but certainly during COVID-19, we've seen differences in how people are reacting, how provinces are responding, and the federal government has to manage all of that from a federal perspective. But we are separate and unique orders of government, and the federal funding formula is not serving healthcare services the way it did in the past, and it has to change in the future.
Next, we have Richard Zisman.
Premier, you mentioned in your prepared remarks around people that are sick not going to work. Will the province be amending the laws to ensure that part-time workers or casual workers can receive sick pay if they do not go to work? And how do you ensure that people are compensated and do not have to make the financial decision around protecting their own health compared to their own financial well-being?
That's a very good question, and we've been grappling with that for a number of weeks. When Dr. Henry made it abundantly clear that no longer can we have these heroic employees, I recall raising with you, Richard, one of the members of the gallery the press gallery here in Victoria, who was quite ill, and this was prior to the state of emergency, prior to the pandemic being formally designated, and I criticized that individual, and we had a lot of laughs about it, but it's deadly serious in this case, deadly serious. And what we discovered with the poultry facilities, for example, is that the majority of the cases that were connected to that one site were people that were still working, including the federal inspectors. Now, that just can't continue, but the economic imperative for many in our economy to go to work regardless of their physical circumstances so that they can make ends meet is a big challenge. Government has a role to play, industry has a role to play. Employment standards, broadly speaking, are a solution to that, but we need to make sure that we're not putting further burdens on companies and businesses who are coming out from what will be a significant shock to their bottom lines. Liquidity is an issue, so we have to work together on a solution, and we've been doing that over the past number of weeks, and we have more work to do. But this is not just for the pandemic. I believe that we need to address the issue of sick pay going forward, and Dr. Henry fully agrees with that.
And I didn't plan it, but Mary Griffin is next.
Hello, Premier. Hello. Thank you for taking my call. I was speaking with Professor Saul Klein from the School of Business up at UVic today, and also with the Canadian Federation of Independent Business, and they were talking about the importance of the province having a plan. And you've said that you're going to outline that next week, but would it not be, because they both referenced consumer behavior is so critical right now, to slowly unravel perhaps ahead of time, just to give some perhaps confidence to the economy?
Absolutely. The economy is people. People are the economy. And all of the businesses that have been shuttered over the past 6 weeks could open tomorrow. And if the public, the consuming public, is not confident in their personal well-being, they're not going to enter those establishments. So this is a cooperative approach. And I didn't want, as other provinces have done, lay out a plan talking about the future, because that gives a signal to the broader public that all is well. You can come out of your home and get back into regular behavior. We are not there yet. Dr. Henry's been pretty clear on that. We're in a good place, a very good place relative to other jurisdictions. But poll after poll and everybody I talk to says, let's not give up the gains we've made by jumping too early, trying to get back to where we were. Because where we were is a long way off, regardless of what the plan says, when it's tabled, how comprehensive it is. We have a long way to go, and we need to do it together with confidence on the business side and on the consumer side, that when we get back up and running, we're not going to have to slip back to further restrictions in the fall or even sooner if we see a spike in cases. That's what's been guiding us. We do not want to give up the position we have in Canada as the jurisdiction that's been focusing on public health first and foremost, and trying to fill, because of the strength of our economy before the pandemic, we're trying to fill those gaps as best we can to keep people going and to have confidence that in this, all of us in this together will be successful.
Next up, we have Samir Kaushal.
Hi, Premier. Premier, as far as the BC's self-isolation plan is concerned, how many passengers have returned to Canada via BC, and how many of them have been sent to quarantine sites from airport? And can you also clarify that whether they have been quarantined because of the fact they did not present the sufficient self-isolation plan, or because of the symptoms of COVID-19?
I apologize, I don't have that data at my fingertips. We'll certainly follow up and get you those numbers, but I can say, broadly speaking, that the vast majority, overwhelming majority of travelers returning to British Columbia had a self-isolation plan. They were approved by the federal and provincial governments, and they went about their business. They spent their 2 weeks in isolation and now can continue limited interactions with the broader community. I can tell you, as of last week, the number of people going into quarantine was low, and it was specifically because they did not have a plan. If people presented symptoms, they were taken in a completely different direction. We wanted to make sure that those who had not contemplated what they were going to do for 2 weeks knew that we were serious about this. If there were symptoms, that's a health issue, and that went into another stream. But we'll get you that data as quickly as we can. While I'm on the subject, though, I have to say that I'm very grateful to the cooperation on the ground of the people providing services at airports and border crossings. Federal and provincial employees have been working cooperatively. No one's concerned about whose jurisdiction is what. They're concerned about making sure that people, when they come into the country appropriately, have a plan to make sure they're protecting not just themselves, but the broader community. I'm grateful we took the steps we did. It was provocative at the time, and now it's second nature, and I think that's how change happens. If you see a problem, try and fix it, and then it becomes normal behavior.
The next question is from Laura Brom.
Hi, Premier. Last weekend when Shane Simpson was announcing getting the plan to get homeless off the street and into indoor shelter, he said there would be supports for homeless in all the hotels, motels, and shelters. Can you please elaborate on what kinds of supports will be made available?
Well, I think that at this point there are upward of 75 or 76 people have been placed in housing that were either in tents in Victoria or Vancouver. And the services that were assessed at the time, those are privacy questions, but they were largely to do with mental health, any addiction issues, any other questions that required supports that the province could provide. And the objective, of course, was to ensure that we put people in appropriate housing, gave them 3 square meals a day and the other services that they would need. I'm sure Minister Simpson or any of the other parts of the team that are working on this file can give you the details of what services are being provided, but the objective was to make sure that these were wraparound services. Judy Darcy, the Minister of Mental Health and Addictions, is a key part of the team working with Shane, and that's her primary objective each and every day. And so having the opportunity to have face-to-face discussions, having care workers there to talk to people as we place them in an appropriate location with the appropriate services is how it should be done. And those are largely privacy issues, but broadly speaking, we can get you the details on what types of programs are available.
The next question is from Lisa Yuzda.
Tapping a bit onto what Richard asked and what I asked Adrian Dix earlier this week about mandatory paid sick leave, you said that this is something that you are working on, but if we're looking at people getting back to business, let's say a few weeks from now, is this something that can be mandated by the provincial government, that whether you're part-time, full-time, you must be paid for when you are off sick? Is this something that can be done? Is this something that you're considering doing, or are you just going to rely on the better hearts of people to do the right thing?
Well, it's more than that, of course. Better hearts are always a good starting point, and I think it's the decency and compassion of British Columbians that's allowed us to get to the place we're at, and I want that decency and compassion to continue as a benchmark for our behavior going forward with each other. Bonnie talks about being calm, she talks about being safe, and she starts with being kind. So I think we should all adhere to those words. But this is a critical issue. There are programs currently. There's the emergency benefit that's available to British Columbians that are affected by COVID, starting on Friday. There's the CERB that's in place. There's a whole host of programs for the pandemic period. So I believe that if you're not well, you should not go to work, and there are programs that you can access today. Those programs won't last forever, and that's why what we're doing across government is trying to find ways to ensure that we allow workers to make those choices for their health and their colleagues' health and for the broader economy without having an economic penalty. And that's going to take some time. It's not an area that we were working on before the pandemic, but it's certainly one that we must work on now because it's just no longer acceptable. And I don't want to pick on Mary again, but I recall doing my estimates debate here in the legislature last year. I could barely speak. I was very sick. I should not have been at work. And there were smiles and way to goes, and that's just the wrong answer. I understand that fully now. At the time, I was obliged to come to the legislature and work because that was part of the schedule. I'm not going to do that again, and I don't expect other workers to do that either. But they need to make sure that there are protections in place. Government has a role to develop those. We need to do it with industry. We need to do it with WorkSafe. That's one option that we've explored, and I think that might be the best one. But we have a number of options on the table, and we'll have more to say in the days and weeks ahead.
Our next question is from Victor Kaiser.
Hi, Premier. Thanks for taking my question. Was wondering if you're able to definitively say if workers in places like grocery stores or at these food processing, meat processing plants that have outbreaks, will they be able to claim, if their claims go into WorkSafe for job-related illnesses, will they be accepted, treated the same way as healthcare workers perhaps who make similar claims when they have COVID-related illnesses? Because we've got word that about half of the claims in so far were not from the health sector. Thank you.
Well, I know that WorkSafe, on their own initiative, not any direction from government, is looking at presumptive cases right now. And I'll leave it to WorkSafe to work with the existing rules and guidelines. But what I can say is that we want to make sure that no one goes to work ill because they feel they have an economic imperative to do so. And that's a challenge that existed prior to COVID, but has been made, shine a big light on it as a result of particularly the issues at the poultry facilities. Now, those individuals can apply for CERB. They can apply for the emergency benefit if they are off work for a period of time because of the illnesses, COVID in this case, but it doesn't have to be COVID to be able to have the good sense to not come to work. And we're working on this. This is a difficult issue. It sort of came out of the blue. It's always existed, but it's critically important now going forward because we have to change that behavior for all time. Dr. Henry says it's not forever, it's just for now. In this case, I think forever, we have to try and find a way that people don't go to work when they could be potentially contagious.
Our next question is from Shannon Waters.
Hello, Premier. We've been talking about the responsibility that employees have to stay home when they're sick, but I wanted to ask about the responsibility of employers. At the beginning of the month, the Ministry of Attorney General put out an order shielding essential businesses from liability related to COVID-19 as they continue to operate, say daycare centers, if there ends up being an outbreak there. As long as they are following provincial guidance and are not grossly negligent, they won't be liable. In the context of the United Poultry outbreak, Dr. Henry has said that one of the workers there told Vancouver Coastal Health officials that some of their colleagues were sick and at work. And when the inspection was done, there were people who had respiratory symptoms who were in the workplace. Do you think that employers who allow visibly ill employees, especially those with respiratory symptoms at this point in time, if they allow them to come to work and be working alongside other people, does that constitute gross negligence in your opinion? If not, why not, and what might?
Well, I could give you my opinion, but it would be just that. There are judicial processes to confirm or deny those points of view that I'm sure people will avail themselves of. The Attorney General's responsibility is to make sure that, and you highlighted, the gross negligence is not an excuse, but there may be other rationales for decisions and actions that employers take. That was the objective of the attorney's intervention. The courts are there. This is, again, uncharted territory. I don't have a yes or no answer to that question, Shannon, but I do know that it's a critical issue and one of the ones that we've been grappling with across government. And it's not just in food processing, it's in a whole host of other sectors. And we need to make sure that we're protecting public health and building confidence. So again, going back to one of the earlier questions about the only way a restart on the retail and personal services side, for example, will be successful is if people are comfortable that they're safe. And a whole host of other parts of the economy are going to be challenged. There's been discussion about tourism. The hotel sector is going to be critically injured over the next number of months because people will not be coming to British Columbia. We'd like to see, I hope, in the not too distant future, people traveling around British Columbia. But you've also seen how communities have responded, rural and remote communities have responded to the prospect of people from away coming for a visit. All of those issues are going to have to be dealt with. Government doesn't have a magic formula there, but kindness and compassion and a sense of confidence that there are processes and guidelines in place to protect public health will allow us to open up completely, not just industry, not just businesses, but communities as well. I'm speaking specifically about the case of Haida Gwaii and Bella Bella and other places who have said, we'd like to see you, but we don't want to see you now. The example that just shines in my mind is Tofino, a tourism town that still feels, rightly so, that they are concerned that people from away could bring the pandemic to their territory and to their community, and they don't want to see that. We need, as a society, to come to terms with how we can all interact together as we did before in the benefit of everyone. The economy is people, people are the economy. They have to have confidence that they can interact with each other. We need to build that, and the only way we do that is if we focus on the task at hand, day by day, flattening the curve and acting responsibly amongst each other as we interact on a daily basis.
We only have time for a couple of more. Ian Bailey's next.
Sorry, Premier, you're being canvassed on the question of sick workers. Just checking on. Clearly it's an urgent issue, but has any timeline been set within government for getting this done, getting this instituted on what's clearly kind of an urgent issue?
Well, it is an urgent issue, Ian, and I apologize. Since we don't interact personally, I haven't been able to tell you how awesome I think the Picard series has been, and I'm looking forward to season 2, and I know you are as well. So I'll get that off the table right now. But we don't have a deadline. We have the comfort that there are programs in place right now federal and provincial, that can help be a backstop. But we need a permanent solution, and we're working on it in earnest. But we're day by day on a whole range of issues. I've said repeatedly there was no protocol, there was no book in my drawer saying in case of pandemic, break glass. I mean, I've been working with all of my colleagues, putting them to tasks and having them resolve them. The work of Minister Fleming on the K-12 sector has been exemplary, bringing everyone together, trying to find a way where parents and kids and teachers can feel comfortable about a restart in the K-12 sector. Similarly, I've been working with across sports, so with Lisa Baer, to try and see how we can get recreation centers to provide programs in a safe way for children this summer. I mean, sports and rec are important to our well-being and our development as we're young, and youthful people need to be out running around enjoying the outdoors. We need to make sure that that's safe. So we've been focusing on 1,000 things all at the same time. This is but one of them. It's critically important, but there's a whole host of other critically important issues as well.
Our next question is from Robert Brown.
Hello, how are you this afternoon?
Good. How about you?
Are you there?
You bet.
Yeah, you mentioned, obviously people are the economy, economy is the people, tourism, we're up here in the north. You mentioned that we're at about just over 1% even tested. How are next week's plans going to reflect the north if there's no data beyond about the 1% that has been tested as of today?
Well, the testing regime has been developed by public health. I'm not going to second guess that. I leave that to Dr. Henry and her team. We have led the country in terms of outcomes. Tragically, 105 people have lost their lives. That's an impact on families that no one wants to have happen to them. The number of cases has been manageable, but the testing regime is Dr. Henry's purview, and I leave that to her. Will we be looking at all of the data that we have available to us as we go forward? Yes. Is there going to be regional differences? I would say yes again. One of the reasons that we announced early our rural, remote, and Indigenous community health plan, our primary health plan, was because we felt that waiting for perfection was not going to be in the best interest of rural and remote and isolated communities. So we put resources in play, whether it be ambulance services, primary care networks, fixed wing and helicopters to get people to acute care facilities if they need them. So we've been developing a whole host of solutions to problems before they emerge. And so in the Northern Health Authority, the number of cases is very low. That's very good news. I think there's a whole bunch of reasons for that, and why we've been successful is in flattening the curve and keeping those cases to a minimum is not exclusively a testing issue. It's more a physical isolation, a physical distancing issue. We're not allowing the virus to be transmitted from individual to individual because we're staying apart. These are the tools that all of us have at our disposal to get better outcomes, and we all need to keep doing that. And that is why we resisted early release of a plan, because we're not there yet. Those parts of the economy that are ready to go, they're working independently. They're working with government to make sure that when the day comes, next week we'll be announcing the plan and we'll go from there. But for now, I want people to adhere to the guidelines and the restrictions that are in place in the interest of continuing to keep COVID-19 out of communities and flattening that curve.
And our last question is from Keith Baldry.
Hi, Premier. This is a little out of left field, but I know you're a big sports fan. I know the Victoria Shamrocks are near and dear to your heart. Sports teams, both amateur and professional, seem to be lining up with their hands out to government, looking for subsidies to maintain survival. Can you see your government ever be in a position of providing subsidies, given there's a lot of competing priorities right now?
Well, that's very true. I am a big sports fan, and it's not just my I love going to the games. I love watching them on television, but it's a tremendous economic stimulus as well. The impact of the Canucks in the playoffs for the beverage industry is significant. There's a whole host of indicators I could roll out showing that professional sports teams, it's not just the gate receipts about who shows up and who has a hot dog and a beer and all of that. It's all the other economic spin-offs. So there's positive consequences of having activity. There's negative consequences of it stopping. We'll take a close look at everything that comes forward. I think people get jaded if they're not sports fans and they look at the salaries that many athletes get paid. I'll tell you that lacrosse players don't get paid that much. Hockey players do, and CFL players are somewhere in between. But they are workers, and they're affected by this adversely, and we need to talk about that. But I've not seen any formal proposals, Keith, come by my desk yet. I know there are discussions underway. Lisa Bear, the minister responsible for sport, is available to hear from people, and we'll look at that in the balance of all of the other issues that are on our plate. But you are right. There are other priorities that are certainly higher. But there is a negative economic consequence to not seeing our professional sports underway this summer.
Thank you, everyone. That's all the time we have.
Thanks.